Welcome back. The Ministry of Health and Social Services is dedicated to the ongoing enhancement of healthcare services throughout the country. The ministry has been actively crafting policies, guidelines and standard operating procedures, as well as providing extensive training. At the heart of these initiatives is the National Quality Policy and Strategy, which outlines its approach to improving quality in the health sector. The ministry will be hosting the inaugural Quality Management Conference with the theme Beyond the Blueprint, Transforming Policy into Quality Practice in Public Healthcare Services. Joining us in studio this evening to provide further insight is Dr. Apollo Basenero, the Chief Medical Officer for Quality Improvement in the Division of Quality Assurance in the Ministry of Health and Social Services. Doctor, good evening and welcome.
Good evening. Thank you.
Thank you so much for being here.
Thank you.
What is the primary goal of the 2024 Inaugural Quality Management Conference that the ministry will kick off tomorrow?
Okay, thank you so much. Yeah, so the main aim really of the conference is to bring together different stakeholders, healthcare workers from implementation level, our healthcare managers, to come together and share what they've been doing to improve the quality of healthcare services. So this could be the initiatives that they are currently implementing or what they've done before to improve the quality of healthcare services. So the conference really provides an opportunity, a platform where, you know, healthcare workers come together to share and learn from each other, and it's part of, you know, peer learning.
Yeah.
Yes.
Talk to us about this theme, Beyond the Blueprint, Transforming Policy into Quality Practice in Public Healthcare Services, and why, you know, it's significant.
Yeah, so the ministry chose this theme specifically because most of the time you find policies, guidelines, standard operating procedures are developed, but what then after developing such policies and guidelines? So the theme really looks at how do we go beyond that, so that when we develop policies, when we develop guidelines, then we need to look at implementation, and not only implementation, but making sure that we look at the outcomes. Are these guidelines, are these policies giving us the outcomes that we want? If not, then how do we identify those gaps and then come up with initiatives to improve so that we get the outcomes that we want? Yeah.
Speak to us about these policies and guidelines and how the ministry has developed these to improve healthcare quality within the country.
Yeah, so basically over the years, the ministry has really developed a number of policies, a number of guidelines that help to guide healthcare workers as they are doing their normal work.
Yeah.
But recently in 2022, the ministry developed the National Quality Management Policy and Strategy, which basically outlines the key activities, key strategies that will be implemented for the next 5 years, so that we are able really to get the quality of care that we want. And when we talk about quality of care, really we are looking at, you know, services that are safe for our patients, services that are timely, services that are efficient, effective, services that are patient-centered. We need to make sure that we listen to our patients and also get their feedback so that it can help us really to improve the services.
The conference will be happening from the 28th until the 30th of August. And as you've mentioned a couple of times now, it's obviously aimed at healthcare workers. So how can healthcare workers that are, you know, within the regions be a part of this?
Yeah, so when the ministry started this initiative of the conference, we put out a call for abstracts. So this call went to all the 14 regions, all the district hospitals, the healthcare facilities, but not only in the public sector, but also the private sector. And we came up with different themes, you know, some looking at, you know, improving safety in healthcare, some looking at improving, you know, the healthcare workers' condition, and different other themes. So then those healthcare workers had to submit abstracts to this conference, and then there was a committee that was set up to review the abstracts, and then those that really you know, were successful are the ones that were invited for the conference. Yeah.
All right. Dr. Basenero, how does knowledge management contribute to the effective implementation of healthcare policies according to the NQPS?
Yeah, so when you look at knowledge management, really, here you are looking at how do we create a platform where people can come together and share what they've been doing. You know, you might be in one facility and you are struggling in a given area, but another facility already has found out ways of improving that area. So with knowledge management, really, it's an opportunity where people come together, they share what they've been doing, so we learn from each other. Of course, when you go back, you don't just go and copy and paste whatever you learned, you need to implement it wisely. Yeah, but it really provides that opportunity for sharing, and also it's part of capacity building. As you are sharing, other people are learning from you what you have implemented. But not only sharing the good things that have worked, but also the gaps, the challenges that you have, so that together we can put our heads together and see how do we address some of these challenges. Yeah.
On that note, talk to us about what quality improvement collaborations are and how they will be used to address gaps within HIV care in Namibia.
Yeah, so quality improvement collaborative it's a structured approach actually that is used to help address some of the key gaps that have been identified in service delivery. It could be HIV, it could be maternal, you know, child health, it could be any other services. So it's a structured approach, and you come up with key gaps that you have identified, and then develop key indicators that you are going to focus on. And then the initiative, once it starts, you keep collecting your data on those indicators. Then the teams come together, look at their data, come up with interventions to improve. And then at the end of the day, with the coaching support that is provided also to the teams, you'll be able to address the gaps. So the Ministry of Health started implementing this approach since 2016. And indeed, there have been a number of quality improvement collaboratives that have been implemented to address different gaps in HIV care, looking at continuity of care, looking at making sure that our patients who are on antiretroviral therapy treatment, their viral load is suppressed, making sure that they are, you know, coming back to care, making sure that they are screened for TB, the ladies are screened for cervical cancer, because these are some of the comorbidities that they can get.
Just lastly, Doctor, what are the expected outcomes, you know, of this conference?
Yeah, so this conference, we hope really to be able to share what has been done in Namibia, and also both in private and also in the public sector. And with that, we hope we are going to together to learn, you know, and go back and implement some of those good initiatives. But also we hope this won't be the last conference. We hope in future we might be able to open it up even to international delegates, so that we are also able to learn from, you know, what is happening around in other countries in Africa, and also in other countries.
That would be fantastic indeed. Well, Dr. Basenero, thank you so much for your time this evening. Thank you for joining us.
Thank you. Appreciate the opportunity.
Well, that's it for Health Matters this evening. Let's take another brief break. We'll be right back.